Hello and welcome to this week's edition of Spotlight on Jackson County. I'm your host, Michael Paul, and I'm really happy to have in the studio with me today a very interesting man, a guy who I met because of a sickness that my father had. Met him in the hospital. He's a local doctor here in Jackson County, and I would like to give a big welcome to Dr. Ikenna.
Thank you.
Dr. Ikenna, say your first name.
Okechukwu.
Okechukwu.
That's correct.
I have trouble with that. I don't know why. Well, I had trouble with Obama, though, when that first started, so...
You get used to it.
You get used to it.
That's right.
You know, as I was mentioning to the audience, I met you because of an infection that my father had in his hip. And you've been working on that now you've been working with him now for probably 6 months on this thing. It kind of flared up.
A couple of months, yes.
Kind of flared up and came back. I know you don't like to talk about patients, but my father, he doesn't care. I already talked to him about it. You can say anything you want to.
We still want to discuss it now.
But you know, it's interesting what you do. And quite frankly, I didn't understand that we even had an infectious medicine specialist here in Jackson County at Singing River Hospital System. And what I'd like to do is for you to just give me a brief description of what exactly it is that you do. And then I'd like to start, because you're such an interesting guy, I'd like to start your childhood in Nigeria where you were born, and let's bring it forward to the future. So what does an infectious medicine specialist do? Well,
infectious diseases, that's what we'll call it. I am an infectious disease consultant. And essentially what we do is see patients that other doctors want us to see, primarily dealing with infections, complicated infections that deal with difficult diagnoses. Most of the things I see include fever of undetermined origin, or basically any infection that affects anywhere from the scalp, the hair, to the toe. That includes meningitis, pneumonias, abscesses, HIV, and many other infections. But essentially, any organ can be involved. But it's usually those ones that are not routine, a little outside the routine, more than average problem that the doctors have. Usually I get a consult.
So basically, you don't actually, people don't just come and say, I want to see Dr. Ikenna. You're referred patients by other physicians who are seeing them, and maybe they don't understand exactly what's going wrong with them.
99% or 95% of patients I see are referrals from other doctors, yes.
I want to talk about Nigeria. You know, it's pretty interesting, your background. I mean, you've got, I'm looking at this list here, and excuse me, I got to put my glasses on because I'm getting old, but you started school in Nigeria as a young man, 1955. And I'm looking at your education here, and it's 4 pages long. Looks like in 1983 you ended up at East Tennessee State University College of Medicine. What a career! You know, tell me how you started in Nigeria and you ended up in Pascagoula, Mississippi, because a lot of us country boys don't understand how that works.
Well,
Nigeria. Tell me about Nigeria.
Well, Nigeria is in West Africa. It is, perhaps, people don't know this, Nigeria is the largest black country on the planet.
Did not know that.
As a planet, period. And we're talking about 110 to 120 million people.
Really?
Yep. People think that Nigeria probably makes up a fifth or a sixth of Africa in population. Not in size, but in population. So it's the largest country in Africa. And one of the largest countries, actually, period, in terms of population. So, and it is in West Africa. And what did you want me to talk about?
Well,
how I
you know, I kind of wanted to start out with your school in Nigeria, because a lot of people here, you know, I mean, we all work every day. It's a blue collar community. I mean, the first question that pops up into a guy's mind here is, you know, how does a guy get from Nigeria, which is an African country, which, you know, you don't, I'm not saying you don't have a high opinion of Africa, you just don't think that a lot of, you know, what we hear about Africa, well, that's where AIDS came from, or that's where this came from. You know, you always hear something bad about Africa, although diamonds do come from Africa, and all the women love those. But I just wanted to kind of get a sense from you what it was like as a child growing up in Nigeria, and how you were able to get the education that you got. I mean, tell me about the school systems there. Sure. Tell me about how you ended up in medical school.
Well, Nigeria was a British colony. like several other African countries. And in our case, so the school system was essentially British. We started off with learning the local languages. I speak one of the local languages, Igbo, and but we start quite early learning English. So I did go to primary school and secondary school in Nigeria, and then ended up going to England for A levels, which is advanced levels, and then my university training, especially medical school, was in Germany. After my medical school training in Germany, I came to the US to do residencies and fellowship trainings, and then spent some time in Nigeria. I went back to Nigeria and spent several years, and came back here.
So after medical school, you were in Nigeria for some time?
No, after medical school, I came to the US and spent about, 7 or 8 years for residencies and fellowship trainings, and then went to Nigeria to work as faculty, to teach at the university, and came back here.
Is this the University of Nigeria? I didn't...
This is University of Maiduguri in northern Nigeria, northeastern Nigeria. Nigeria has, I don't know, 30 or 40 universities. Mm-hmm. So it's a huge country. So we have many universities. The education system actually is quite good, at least was very good in my time. So there wasn't any issue about quality of education. Now, we can complain about them, not right now, but back then it was pretty good. And it's a large country, as I mentioned, so there are numerous universities, even as we speak. So it isn't, what's the word? You will find many people from Nigeria who are able to compete at any level, because I think this education system is fairly decent. Now, it's still a resource-poor country in spite of the fact that Nigeria produces oil.
Right.
But it's still considered a third world country in many ways.
Well, you hear, occasionally of a problem with particularly the oil, that locals will come and try to destroy the area. I can't even remember for instance, but I've heard it, and I do recall vaguely that you do have some I guess you would say some militants in the country that try to stir trouble. Is that one of the things that keeps Nigeria from moving forward? I mean, how does the political system work over there?
Well, the system is pretty complicated. I don't consider myself an expert, but the fact is that we had military regimes for several years, and in the last 2 or 3 regimes have been, but we've gone back to the civilian regime. So there are elements in the country that are unhappy with the oil companies and the way they operate in several areas. So you do find a group, that's a militant group or groups that are active in trying to seek redress. But that's a political thing that are working through with the government. Well, but that's only in a small part of the country, because oil is not everywhere in the country, it's only in certain areas.
Is it on the coast more?
The coast, southern states primarily, but not just on the coast, but in many of the southern states, yes.
What's the countryside look like in Africa? What in Nigeria in particular? What kind of, is it tropical? Is it desert?
Yes, Nigeria is considered tropical, but it has many different regions. We have the rainforest region, we have the savanna belt, and we have the dry savanna and wet savanna, and then of course the semi-arid zone in the northern. Nigeria spans from around 5 to 14 degrees latitude.
Right.
So it's you have all very thick rainforest to sparse grassland. So it has all those from savanna to rainforest.
It's interesting. Have you had the opportunity to travel across Nigeria and see these areas?
Yes, indeed. I was born in the southeast of Nigeria, but actually worked in the northeast, when I went back to Nigeria. So I've seen the country.
Your hometown, how do you say that, Aba?
Aba, ABA.
ABA.
Yes.
Now, how is that in relation to the capital, which is Lagos?
Lagos used to be Lagos. Right. Okay. Lagos is Portuguese, actually. Okay. Lagos used to be the capital, but right now the new capital for the last 20 years is Abuja, A-B-U-J-A.
I've been keeping up, huh?
Right, that's right. A-B-U-J-A, right. That's the new capital, but Lagos is still the biggest city in terms of population.
You have brothers and sisters?
Lots of brothers and sisters.
And they all still live in Nigeria, or they?
Well, my family is all over the place. I have about 5 family members here and others in Nigeria.
Any other physicians in the family?
I have a sister who's a pediatrician, and I have another sister who's an optometrist with the Navy here.
So, you know, you guys came from a pretty smart family, apparently. It's amazing to me. I mean, I'll tell you, and I told you when before we started the show, you've even just recently finished a new master's degree in, what was it? Public
health.
Public health.
Yes.
What makes you want to continue this educational process even as you are, you know, established as a physician and you're doing your job every day? What makes you continue to want to learn and know more about these things?
First, I think the job demands it. The second thing is you have to enjoy what you do. And with respect to the public health, this is really something I wanted to do 25 years ago. So this is like catching up. So, and it's, in my opinion, it's all a continuum. It's not anything very separate or different. I think it's, I see a connection between public health and infectious disease, kind of population medicine type thing, and all the other things I do. I mean, you wouldn't be an infectious disease specialist if you did not do internal medicine. So it's all, they're really not unconnected.
It's so when you started out, you wanted to do something with public medicine. You knew that.
No, I mean, when I started off, you go through medical school, and while you're in medical school, you ask yourself, what do I want to do after graduation? What specialty? I ended up in internal medicine, which is what I wanted to do. But then you want to do something beyond that. That's why I ended up in infectious disease.
That's interesting. I'll tell you what, let's take a quick break, and we'll come back in just a few minutes, and we'll talk about some of the papers that you've written. We'll talk about some sexually transmitted diseases and the possibilities of some cures for them and some other things with Dr. Ikenna. We'll be right back. Hey, welcome back to Spotlight on Jackson County. Michael Paul here with Dr. Ikenna from Singing River Hospital System, local infectious medicine specialist. And golly, you know, we talked about your childhood in Nigeria and the country of Nigeria, and you know, you going to Germany and going to medical school, and you ended up here in the United States, right here in Pascagoula, Mississippi. We're really happy to have you here. And of course, you know, we talked about my dad and how you and I met. But you know, I'm looking at your resume, and quickly, you know, one of the first things you did back in from 1988 to 1994, you were the physician in charge of the Sexually Transmitted Diseases Clinic at the University of Maiduguri Teaching Hospital in Nigeria.
That is correct.
You know, people think about this a lot. I mean, the AIDS virus, for instance, and you must have seen a lot of that being in charge of what you were in Africa, and it always. I always wonder, and I'm sure that other people do as well. You know, it seems that in times of late that they've come up with some cocktails to kind of back that virus off a little bit and let people actually live a normal or semi-normal life. What is being done on a global scale, and what are the chances are finding a cure for, let's say, AIDS, or even something as simple as herpes, which is you know, you can get them on your lip, and of course you can get them in other places as well.
Sure.
What's going on with that, and what do you think the possibilities of finding a cure or something that will stop this virus? What is a virus as compared to a bacteria? You know, you give penicillin for bacterias. What do you do for viruses?
Well, up until fairly recently, and I'm talking about 20, 30 years, there really were no treatments available for many viral illnesses. Viruses are best described as intracellular organisms that live within cells, that cannot live outside cells on their own.
Okay.
That's a general description, because they require elements, nutrients, and whatnot of the cell that they use to propagate or just grow.
So as they enter the body, they move inside.
They go into some cell in the cell, and that's how they are able to operate. Bacteria can grow outside the cells and do damage. That's a general way. And the viruses are generally smaller than bacteria. Now, with respect to the AIDS virus, HIV, human immunodeficiency virus, I think all experts, at least for now, believe that this is probably going to become a chronic disease that is currently being kept in check, maintained. And people are able to live with it for relatively long periods of time. We don't know how long. But there is no cure in sight. The hope is that at some point in the future, there will be a vaccine that will prevent the disease. And that is actually the hope. There is no vaccine so far in prospect. I don't know if that I think that's important to make that clear. A lot of young people need to understand that there is no cure for this disease, and that if you stop taking the medications, the virus comes back. And that's kind of the state of the knowledge that we have at the moment. But there are good treatments. You know, they're not easy, but they're much better than they used to be. You know.
What about the common cold sore? It's one of those things that just aggravates you in your life.
Sure.
And you know, what are the chances of a cure for something like that, or is it very similar to the AIDS virus in the respect that it's a virus and there's no way to get to it?
Well, the common cold sore, also called herpes simplex type 1, most of the time, is common. And unlike the bacterial infections, they can come on their own without any obvious warning.
Yeah. Is there any?
But usually it's because something happens in the system. You got a fever. It's also called fever blister. But it's not really dangerous in itself, except that it's a sign that something is not right. And that's the thing that is not right. Could be stress, could be an infection elsewhere in the body. But these are viruses that are never really completely eradicated. They are not a problem unless the person concerned or involved has some immune deficiency or problem, has some problem.
How is it? And you know, of course, I'm no doctor, but I would like for you to explain to me how it is that you can get a cold sore, and it goes away. And it may stay gone for years. Absolutely. And then all of a sudden it shows back up. Explain to me the physiological process behind that. Why do they do that?
I don't know that we know that for sure, but we know that these viruses are never completely gone. They sort of hang on or are held in check in the what we call sensory ganglion, some of the nerve cells, and they are there only to show themselves every now and then when something goes wrong. The thing that goes wrong could be stress, defined in any way you want to describe it. And that stress could be physical, it could be mental, it could be physiologic, and it could be related to injury of any type. So that's why these colds, or rather cold sores or viruses, tend to appear for reasons that are not often cleared. So they're actually kept in check by the immune system. They are never really completely cured. And we don't have a cure either for herpes simplex, which is what we were talking about.
Yeah, I guess it's something that bothers you. You know, it starts from small children, and it can bother you through your entire adult life. I was telling you,
Right.
I used to get them occasionally, and for some reason, they don't show up anymore, and I don't know why that is. It was just bizarre to me that I would get them so frequently, and then it just stopped.
They're more common in children, and over time they should go away. But they can show up again during times of extreme stress.
Now, are there any drugs you can take to lessen the effect of that? Is there anything? I mean, I guess a physician could help you with that if you have a problem with it.
I mean, there are medications available, and we don't want to advertise any drugs on the radio or on the air. But there are antiviral regimens you can use to keep it in check. But there is no antiviral drug that cures cold sores. Period.
Gotcha. Let's talk about when did you? What year you came to the United States? What was your first year here?
Well, initially I lived in the U.S. between 1980 and 1988, and during that 7.5 to 8 years, I was basically doing residencies and fellowship trainings. I did internal medicine, infectious disease, and microbiology.
So you started out as an internist, I guess is the way that they describe that. And like my old friend Bob McBroom, who just died, great guy, and I'm really going to miss him. And of course, that was my father's doctor as well, and we really loved Bob and
a good friend of mine too.
Yeah, great guy, and he'll be sorely missed around this community for sure. But just so people will understand, what you did when you first started here, what made you get interested in this infectious aspect of the internal medicine?
Well, to be honest, when you're a resident doing internal medicine, you often ask yourself, what will I be comfortable with? I thought infectious disease was intellectually challenging. The other thing, it was also probably one area of medicine that kept in touch with every part of the body. I did not want to be a body specialist. so that was one reason. And the other thing I was thinking about, I wanted to do something that would have population relevance, that went beyond the individual patient. And remotely in my head, I was also thinking about Africa, and those were the things that kind of went through my head. I enjoyed it, by the way. Perhaps one of the most important reasons I went in there were that 3 of our faculty, at the time when I was a resident, were all infectious disease guys, and we really got into liking the thing. We were required to go look at our own stains, gram stains, and so I worked with the people in the laboratory, and I really enjoyed it. So it was a natural for me to go in there.
I'm going to use my father again as an example. Of course, you're his physician, and I already said he doesn't care.
Right.
So I'm just going to give you an example. You have somebody who has this low-grade fever, and they have a problem with their hip. Their hip hurts. They have a low-grade fever. So you ordered a biopsy to find out what it was in there. Now, what do you do with that? Once you get that sample, that tissue sample, what do you do to find out what exactly that organism is that's bothering them?
Well, you send the specimen, whatever it is you have, tissue or pus, to the laboratory. The laboratory will then do stains that you request, and the stains are of various types. Sometimes you can find the organism, and then they will do subsequently cultures on the specimen. And another specimen goes to the pathology department for what we call histopathology, looking at types of cells there to give you an idea what forms, what types of cells may be present. And you try and put the 2 and 2 together along with the history of the patient gives you. And you then, hopefully, if the organism grows in culture, good. If it doesn't grow, you do what we call an educated guess, based on all the data put together. Yeah. And that's kind of how you base your treatment. Remember, in medicine, however, we don't have the luxury of wait. You have to start treatment before you have all the data, because it may take days, weeks, depending on what the issue is.
Well, I guess it depends on the patient, but if the patient's ill,
right,
you have to kind of make an educated guess and start something immediately.
Absolutely. We do that routinely.
Yeah,
you have to actually do that. Otherwise, things could go wrong.
But also, at the same time, just following my father's case, antibiotics that are administered can sometimes skew the results of a test that's made at a later date.
Absolutely. What I say to patients or the other doctors is, if somebody's not that ill, wait. Because if you treat before you know what they're doing, then you create confusion. If they're very ill, you have to treat while you're starting out there.
How long have you been in Pascagoula now?
Well, I came back here. I came here in 1994, specifically October 1, and I've been here almost 14 years now.
How do you find the Mississippi Gulf Coast as compared to your home where you grew up in Africa?
Well, I can tell you the weather, the heat is as bad here as it is up my place. at least in summer.
Yeah, we have very, very nice winters.
Right,
here.
We have no winters in Nigeria. Yeah. I mean, well, it's a little cool in the northern part of the country sometimes for a few months, but we really don't have a true winter, so that's different. But I have lived in Germany, so it was colder there. So I'm quite happy to be in a warm climate.
Yeah, I bet. Now I've noticed that you've been on the staff of Singing River Hospital for a while. I think, my goodness,
well,
let me look.
Since '94.
Since 1994, that makes sense. My Pascagoula math. You also you do a few other things too that are kind of interesting. You write papers. We were talking about this before or during the break. And you've done several publications.
Every now and then.
Well, I was just looking here. This is good stuff. I mean, I'm looking at published monographs. What is a monograph?
Well, a monograph I would describe as something smaller than a book.
It's not a pamphlet, but it's not a book.
Maybe a small pamphlet, maybe larger than a pamphlet, but really, sadly, doesn't qualify to be a book.
What makes you? What's the reason why you write one of those? Just curious.
Well, it depends on what the issue is. I mean. The 2 that are probably listed there would be, I was involved in writing a manual for our laboratory back in Nigeria, and we called it, I called it a monograph because it wasn't that thick.
Right.
But it was practical stuff that they could use in working up specimens. The other one would be something to do with STDs that had issues addressing treatment or diagnostic at various levels.
Right.
So that is not a book. So it's something much smaller than that.
You know what? I hate to tell you this. We're out of time. I've really enjoyed talking to you. You're an interesting guy, Dr. Ikenna, and I want to thank you for your service to the people of Jackson County and Singing River Hospital. Some people have told me you would do this for free. So I don't know if that's true or not, but I know you enjoy doing what you're doing.
I do.
And I want to thank you on behalf of the community.
Thank
you for coming in here and talking to us
Thank you
this
very
week.
much.
Thanks for joining us on Spotlight Jackson County. We'll see you again next week. Bye.